COVID-19 has put public health top of the mind. It has spread a lot of awareness about public health. The question is translating that awareness into action. That's the big challenge in a way of our times in this country. And this week, a unique initiative, a Lancet Citizens Commission, aims to do just that by creating a roadmap that could ensure universal health coverage in this country. That's the ambitious project that brings together some of the finest minds from the world of academia, medicine, science, business, all of them coming together with this one objective. We're joined today by the 4 India co-chairs of the Lancet Citizens Commission. Joining us, Kiran Mazumdar, Executive Chairperson at Biocon, Tarun Khanna, Professor at Harvard Business School, and Director Lakshmi Mittal and Family South Asia Initiative at Harvard University, Dr. Vikram Patel, Professor of Global Health at Harvard Medical School, and Dr. Gagandeep Kang, Professor, Christian Medical College, Vellore. 4 fine minds joining us on a very important subject of our times. Let me come with you, start with you, Kiran Mazumdar, because the idea of universal health coverage has been discussed for years in this country. A number of government programs have been put up in this regard. Why the need for a citizens commission in your view? What difference could that really make in the times in which we live?
So, Rajdeep, that's a very important question because up until now, universal healthcare or medical practice has always been a very prescriptive approach to healthcare delivery. And what we are trying to say is that in this information age, people want to ask the right questions, they want informed decision making, they want transparency, and they want to make sure that they get what they expect. And for all this to happen, it must be a citizens' engagement that gets us to the right point. So I think this is the first time we are actually looking at this as an inclusive process, a consensus building process, and to understand what the recipients of universal healthcare want for what is being promised to them. So I think this is going to be a very interesting exercise where we are going to work very closely with the government's own, initiatives of universal healthcare, which is, the Ayushman Bharat and the National Digital Health Mission.
Ayushman Bharat.
Yes. Ayushman Bharat and the National
the point, the point, Dr. Gagandeep Kang, is, has COVID-19 been a wake-up call in a sense? Has it made us realize perhaps where the system is flawed, what needs to be done? In a sense, have the last 9 months in a way pushed public health top of the mind? The challenge obviously is to sustain that engagement.
I think public health has never been in the public eye as much as it has in the last 10 months. So while many of us who work within the public health care system were aware of the challenges, knew where there were structural and functional weaknesses in the system, it has really become front and center for everyone. We've recognized that access is a huge issue. We've recognized that inequity is a huge issue. We've recognized that there are challenges with affordability, and all of these need to be addressed in an integrated fashion. We think that this is an opportunity. It always existed. It's just been highlighted and strengthened by the pandemic that we are now facing.
But in a way, and I'm sorry to be cynical there, Dr. Kang, is how do you actually translate a fine idea into actual action on the ground, particularly in a subcontinental sized country of ours, where there are such wide gaps in the quality and access to quality health care? How do you actually translate it into action?
I think we have had examples of where we've taken on ambitious projects and been able to deliver on them. If you take a look at what is done, with example, for space science in this country, if you take a look at what's done in terms of atomic energy missions in this country, we do have programs there that are world leading. I think what this pandemic gives us is an opportunity to recognize that if you really want economic prosperity, you can't do it with an unhealthy population and systems that cannot provide preventive, promotive, and curative care. For too long, we have relied on hospitals to provide the care that is required. Now we know that prevention is equally important. The ability to handle pandemics and outbreaks can only be built on the back of a strong primary health system. Some initiatives from the government have already started. Kiran mentioned Ayushman Bharat and the Digital Health Mission. I think what we need to do now is think about integrating different systems of medicine, making sure that we bring together not only private and public health care, but also what is happening in Ayush, and look forward in the same direction instead of looking at problems in very different ways. We have a federal structure here. The center provides regulation and rules, and states execute. So go ahead, Rajdeep.
No, I understand. I want to understand where, Dr. Patel, you start. Where does a Citizens Commission start by ensuring that the citizen himself or herself feels part of this process of ensuring equal access to quality healthcare? Where do you start, Dr. Patel?
Yeah, so Rajdeep, first of all, I just wanted to say that one of the things that this pandemic has taught all of us in this country is that healthcare cannot be viewed, as it has been for decades, through the prism of charity for the poor and a commodity for the rich, but as an essential and fundamental element of sustainable development for every single Indian citizen and for the whole country. I don't think there's ever been a moment in our history at which time there is no question in anyone's mind that health is central to everyone's well-being. Now, the question of how we start with citizens' engagement, you really pointed out a very important challenge that we face, which is the fragmented nature of healthcare in this country. And the very first step really for us to accept is that that challenge can only be addressed not through top-down diktats, but through engagement, through participation, through conversation, through discussion, and through generating consensus from all the different sectors and players. And a key sector here really is the ordinary citizen, who has to bear the brunt of what is actually one of the most regressive healthcare systems in the world, thanks to the very high levels of out-of-pocket expenditure, which is one of the leading causes of poverty in India today. So our task really, Rajdeep, is to begin to consult people in the community, to consult ordinary citizens by asking them, as Kiran mentioned earlier, what are the critically important challenges that you face when you access healthcare, and how would you like to see healthcare transformed so that issues like out-of-pocket expenditure and quality of care and trust between the citizen and the healthcare system can be restored.
Right. So in a way, you're preparing a roadmap for the future, but a critical element of that is also putting together a structure, Professor Khanna of Harvard Business School, because finance is a critical issue, governance models. Many believe part of the problem of public health in this country, or healthcare in general, has been the governance model that has been in place. It's never been of the requisite standard. So how do you ensure that? How do you bring together Lancet, the world's leading medical journal, Harvard University, stakeholders in this country? How do you create a governance model that perhaps could be embraced by everyone?
Rajdeep, that's a great question. In the last couple of sentences, you said two of the words that describe two of our 5 work streams. We have a finance work stream that's dedicated to just understanding both the aggregate amount of money that's going into public health and health in general, And of course, there's been an admonition for a long time, and the government has stated its intent to raise the spending that it does as a percentage of GDP from a very low level to something that's more in line with perhaps international norms. So that's good news. But perhaps as important, maybe more important, depending on who you ask, is that currently, speaking with an economist's hat on for a second, the allocative efficiency of the money that we spend currently is really quite poor. And if you step back and think about why that might be, we simply lack the data around the country about how our existing rupees are being spent, what we're getting out of it. Gagandeep alluded earlier to the need to focus a lot more on prevention than simply on after-the-fact cure, the need to diversify, the focus of how health is done, not from away from hospitals and towards primary health clinics and so on. So, how the money gets spent is such an important piece, and we just haven't created the architecture historically to do this. So one of the work streams in our Lancet Commission is dedicated to finance. The other, as important, more important perhaps even, is the idea of governance that you alluded to. There is so little trust in the system currently, and you can find so many schisms in the Indian healthcare system. Again, we've already talked about the federal structure, so it's not really a schism, but it's certainly a place where the message sometimes get lost. We have the Ayush versus the allopathy debate that's been going on in the country for a long time, and we have to bring these views together. And of course, we have probably the biggest of all, which is the public sector and the private sector. And, the view of the commission, if you look at the commissioners that have come together with such good, if you will, sportsmanship to begin to debate and discuss all this, they really come from all sectors of society. And in many cases, we're trying to build these conversational bridges between them so that we don't end up in finger pointing and insisting that, our end of the spectrum is better than someone else's. So, we agree that governance and financing are super important, and appropriately, those are focal areas for the commission.
Because if you look at just finance, Kiran Mazumdar show what? India's total healthcare spending out of pocket and public 3.6% of GDP, way below that of most other countries. There's a sense also that for all the talk, health allocations at times to states have actually come down. Some states at least complain they don't have the monies at the moment. Given those financial constraints, how do you prioritize healthcare? The worry is that once the pandemic is over, will healthcare retain that kind of priority that it has today?
Well, as Gagandeep very rightly alluded to, I think healthcare has to be integral to our economic agenda. Because I think without that, I think we will again be staring at another health challenge, which this pandemic has made us realize. So I think there's no debate about that. But the question is, I think the government is certainly, seized of this opportunity and realizes and recognizes the importance to increase healthcare expenditure. But I think the question is, how much and how do we do it with a sense of accountability, transparency, and efficiency of allocation of finance. So I think all these are the kind of questions we're going to ask. I mean, we don't have answers right now, but I would say that this is a commission that will ask the right questions and try and see what models can work for a country like India, because we certainly can't afford to spend the kind of GDP percentage that other countries spend. But for us as a large country that we are, what is the right level of expenditure that will actually buy us or deliver us a decent basic quality of healthcare? And I think that has to include the preventive primary healthcare model, which then transcends into the tertiary healthcare model. So I think we need to find the right balance. And of course, we also need to combine the human capacity required to deal with healthcare. And of course, citizens' engagement is central to all this, because we do need to understand what the citizen wants. And we are going to use technology as an enabler and as a transformation agent to basically deliver healthcare efficiently and in an affordable way. So these are questions we'll have to ask. We'll have to see how technology can actually get to the people who need it, and can they the way it should be used. These are some questions. ASHA workers are there. Can they be trained to be technology assistants? Similar to what has happened in the financial inclusion sector. So this is about inclusive healthcare, where we have to look at all aspects of what we've just discussed.
Dr. Kang, do you see a model across the world which we could embrace, or will it have to be a uniquely Indian model for public healthcare in this country? Do you see a successful model across the world that maybe India needs to emulate, or does it have to be a bottom-up approach where different states in this country have different concerns? If you can't compare, for example, the public health system of a Kerala with that of a Bihar.
So I think the idea of inequity is one that is well recognized in India, and that is inequity across states and within states as well. So if we look at models around the world, there are very few places that deal with the kind of healthcare challenges that we have. The level of non-communicable diseases, the level of communicable diseases that we have. So I don't think that we can take something that is on a shelf somewhere and apply that to India. And that's the reason. Now, if we look at model systems within the country that have tried to integrate provision of care across scales, there are examples, but those examples are not necessarily scaled. So understanding the challenges in scaling what is already existing good practice in the country will help us identify which components of the roadmap need to be developed greatly or lesser in different locations. So the center-state relationship is one that requires us to think about what needs to be done at which level, both in terms of policy, in terms of regulation, and in terms of execution.
Because another challenge, Dr. Patel, is in a country like India ensuring a public-private partnership. In your stakeholders, in the commission, you have representatives who've served in government, you have others who distinguish themselves in the private sector. Now that may work in the commission, but in the wider world out there, how do you achieve an element of trust and partnership between public health services and private health services, given that their goals are very different?
Yeah, I think, Rajdeep, this is a challenge that is also not unique to India. I mean, let us not forget that in 1945, when the UK's National Health Service was created, the entire system of healthcare looked exactly like the one in India today. That there was essentially a private healthcare system that catered to the rich from Harley Street, etc. And then you had the kind of very low-funded, poor-quality public hospitals for the poor. Even today, it might surprise many people to know that in many parts of the world that have universal health coverage, in which the citizen pays nothing for healthcare except through their taxes or other kinds of prepayment methods, the providers are often private operators. For example, every general practitioner in the UK is really, actually, practically speaking, a private provider. So I think, we can learn from other places. I agree with Gagandeep that we do have to develop a homegrown system. We also have to recognize that every state will have potentially a different kind of model because, of course, most spending on healthcare is actually at the state level. It's not a central expenditure, it's a state level. I think it's about 80% is actually spent at the state level. But I think equally fair to say that we're not the only country that have had this kind of fragmented, splintered healthcare system, the private, public often competing with each other. And we can actually learn from other parts of the world in how the private system has become engaged with, is part in solidarity with the state to actually achieve universal health coverage.
One of the challenges also, Professor Khanna, and I'm sure you discussed this in business school, is enhancing skill development. Whether it's at the private primary health centers, ASHA centers, how do you improve the quality and the skills of people at the bottom, in a sense, of our public health infrastructure. Do you believe skill development needs a much more robust investment in educating lakhs and lakhs of health workers across this country? And that is, again, something that will require huge amounts of finances.
Yeah, so again, Rajdeep, I mean, I'd certainly agree. I'm not minimizing that this is going to take a lot more rupees than we have traditionally allocated to it. But I think one of the things that we learn in business schools is that a lot can be done through organization and management that's much, much better. As Vikram just said, there's so many models around the world that have addressed even these issues. So, for instance, this concept of task shifting, right? Because we have relatively scarcer medical personnel at, shall we say, higher levels of training than you do community health workers or you do nurses and nurse practitioners. And as you move up the amount of time that it takes to skill different people, there are ways of making sure, setting up, if you will, governance protocols within the actual delivery of healthcare that allow you to shift tasks away from relatively scarce buckets of human capital towards things that are more easily available. And that's not, again, unique to India. It's true in most countries around the world. And also, one of the things we haven't spoken about, Rajdeep, in this brief engagement is the role of technology. Kiran had alluded to it in the beginning. But I think there really is sort of a step function change in decentralized point-of-care diagnostics and to some extent treatment delivery that's unfolding around the world. I see it in my own backyard out of my window right now in the Cambridge, Boston, not the Cambridge, England, Cambridge, Boston medical ecosystem, right? There's so much ferment and so much technology, much of it can actually be adapted. I wouldn't say easily, nothing is easy here, but can be adapted in principle to the needs of countries like India. And much of it is actually being developed in places in Bangalore and other parts of India. So I'm very optimistic that with a combination of better models of management, learning from existing experiments and technology, we can make progress on human capital.
I just have a minute or two left. I want to give each of you 30 seconds to give us what is your big vision that you see for the future and the one thing that you would like to see change in the years ahead to achieve this ambitious goal of universal health. You start, Dr. Shaw. The one thing, 30 seconds.
Well, I think we're all working towards an inclusive and reliable and trusted process where citizens will definitely get a fair deal when it comes to healthcare. So I think we're asking, the right questions. We want to get the citizens involved and really come up with a credible commission that can make a difference.
You keep saying citizens involved, so I presume you'll do a large-scale survey across the country,
Yes.
perhaps the largest that's ever been done?
No, what we plan to do is to really adopt a number of surveys, research, projects, and a lot of pilots to make sure that they can scale up.
Dr. Kang, your vision for the future?
Well, I'd like a system of healthcare that provides access to all people, delivers quality care, and does not impoverish them.
And an interesting aspect, which of course Tarun also mentioned, was that of technology. Dr. Patel, do you believe this is an over-ambitious goal to have this roadmap in place in the next 12 to 18 months?
Well, whoever had a good time not setting themselves an audacious challenge, I think this is an audacious challenge. I hope that we can meet again in August 15th, 2022, when we celebrate our 75th year of independence. And you can ask me again, was I being completely off my head in making this challenge? But let me answer the question you had about what I hope this commission will achieve beyond delivering a report, because a report is only one step and, it could be binned. I hope the Commission really serves as a foundation for propelling a citizens' movement across all sections of our diverse communities to demand and to contribute to the practical realization of the aspiration of health as a fundamental right.
Well, I think that health is a fundamental right, and if in the 75th year of independence we can achieve that, or at least have a blueprint for that, well, we'll have made progress. I think the one thing that the COVID pandemic has done is even force the media to, in a way, mainstream public health, something that hasn't been done for decades. And we've managed to have this conversation, which in itself is perhaps a small step forward. All the very best to the Lancet Citizens Commission to bring together these fine minds to take up the real challenge of our times, that of public health. Thank you all very much for joining me, Professor Khanna, Dr. Patel, Dr. Kang, and Kiran Mazumdar Shaw. That's it on this very special broadcast. Thanks for watching. Bye for now.
Hi everyone, Preeti Chaudhary here. Hope you like this video. For latest news and analysis, like and subscribe to the India Today YouTube channel. And don't forget to press the bell icon to stay updated. Thank you for watching.